I call the member for Solomon.
Thank you, Mr Deputy Speaker. I rise today to speak on the Private Health Insurance Amendment, Lifetime Health Cover Loading and Other Measures Bill 2012. While this bill is part of a cognate debate with the Private Health Insurance Legislation Amendment Base Premium Bill 2013, due to the Gillard Labor government once again rushing legislation through the House without allowing the Coalition appropriate time to consider the bill through the normal processes, I will be focusing much of the debate on the first Private Health Insurance Amendment, Lifetime Health Cover and Other Measurements. Deputy Speaker, those on the other side just don't understand how important it is to have a strong private health system to support a dynamic public system. The Coalition recognises the importance of planning for the long term to meet the challenges that will come with an ageing population. On this side of the House, we recognise encouraging the growth of the private health system, which will help reduce the pressures the ageing population will place on our public health system. When the Howard government left office with a legacy encouraging the uptake of private health insurance, supporting those Australians who wish to take out private health insurance for their families while still supporting a vibrant health system. The Gillard Labor government, on the other hand, continues to mislead the Australian people. Before the election, they supported private health insurance, and now after the election, they're doing all they can to discourage the uptake of private health cover. In the Courier Mail on the 23rd of September 2004, the Prime Minister, Julia Gillard, who was then the opposition spokesperson for health, said, "Labor is committed to the maintenance of this rebate." And yet today in the chamber only the members of the Coalition stand in this parliament here ready to defend the private health insurance rebate. Again, it's left to this side of the House to defend the Gillard Labor government's own promise that they made at the last election. All these broken promises are creating a huge stress and anxiety against Darwin and Palmerston residents. As I've just had discussions with mums and dads and grandparents, I'm told over and over again that they are so worried for their children's futures, they just don't know how they can cope. They talk about the chaos and the instability wreaking havoc inside the Gillard Labor government and the uncertainty it is creating in their lives. On the ground throughout Solomon, I hear huge concerns with the introduction of the carbon tax. The carbon tax, which we were told we were never going to have. Another broken promise, Mr Deputy Speaker. And the failure to deliver the surplus that Treasurer Swan promised would come hell or high water. Well, the people of Solomon cannot handle any more policy on the run. They've really, quite frankly, had enough. And yet today we're in this place again discussing another Gillard Labor government broken promise. This is now the second time the Gillard Labor government has reneged on their commitment to not cut the private health insurance rebate. Just another blow to the already struggling, hard-working families of Darwin and Palmerston. Deputy Speaker, in my electorate, we have a huge defence population, and according to the 2011 census, a median age of 32, while Australia-wide it's 37. And yet, according to the Private Healthcare Australia, as of the 1st of January 2013, over 53% of my constituents had some sort of private health insurance. As we know, back in July 2000, lifetime health cover was introduced by the Howard government at a rate of 2% per year loading on insurance premiums applied to individuals over the age of 30 when they took up private health insurance, capped at 70% and removed after 10 years of continuous cover. This initiative was introduced to promote the uptake of private health insurance at a young age and encourage individuals to retain their cover over their lifetime. Well, I know I certainly did that, Mr Deputy Speaker. The Howard government, as the Coalition continues to do today, understands the challenges of an ageing population, that supporting the growth of the private health system would reduce the pressure of an already strained public health system. Currently, the private health insurance rebate is paid on the total of the premium and includes the lifetime health cover loading. This legislation put forward takes away the part of the rebate that covers the lifetime health cover loading. The legislation will also cease the incentive payment schemes which allows the direct claiming of the private health insurance rebate through the Department of Health Services. It's estimated that these new measures will see a budgetary savings of around $386.3 million. This, of course, comes at the expense of mums and dads throughout my electorate of Darwin and Palmerston, which has been estimated that the premiums will increase up to 27.5% from the 1st of July 2013 under these new measures. Constituents across Solomon tell me they just cannot continue to endure the financial pain that this Gillard Labor government is inflicting on them. They are struggling to keep their heads above water, or some of them are. Since the changes to the private health insurance rebate were announced in the latter part of last year, I'd been contacted by a number of constituents from across the electorate opposed to these changes, and I'd like to share some of those stories with you, Mr Deputy Speaker. Yesterday I received an email from Robert Milliken of Fanny Bay, who raised his deep concern that these changes would force prices up for private health insurance. Robert told me how he was so worried these changes would be yet another legacy from a failed Labor government. Kelly Hawkes of Bellamac emailed me deeply concerned with these changes. Kelly said it was becoming too expensive for me to be insured. Shirley Andrews of Mille Lacs emailed me telling me that private health insurance rebate is of vital importance to allow me to provide health cover for my family, and that because of the changes I may well have to consider dropping my cover. Catherine Carver of Allawa and Anita Goodaby of Parap contacted me to say they fear that changes to the private health insurance rebate would mean private health insurance cover for their families was out of their reach. Then Julie Donohoe of Wanguri emailed me to say she was worried that these new changes would mean it was no longer affordable for her family to have cover. I was contacted by Judith Pollitt of Stewart Park, who was upset that these new proposed changes will hurt Australians like me. Daryl Holmes of Leanya had contacted me several times, raising his concerns with the proposed changes. In March, he told me how recently he underwent back surgery at a private hospital in Sydney, a procedure that has an extended waiting period in the private system. And if Daryl had not had private cover and was forced to be on the public waiting list, that wait may have been too long, causing permanent damage and forcing him to be reliant on a wheelchair for the rest of his life. For Daryl, the public system was just not an option, and then he sent me another email only last weekend telling me how he feared that these changes, because he was likely to have to drop out of his downgrade his insurance. It's not fair or reasonable to expect that hard-working people of Darwin and Palmerston live their life with such uncertainty. The Gillard Labor government has overindulged, broken their surplus commitment, and now they are cutting rebates to hard-working families that provide them with the support they need to gain access to those frontline health services. And this comes after we've already seen the means testing of the private health insurance rebate saving $2.8 million. On the 24th of February 2009, the former Health Minister and the member for Gellibrand, Nicola Roxon, said the government is firmly committed to retaining the existing private health insurance rebate, and yet they have broken that commitment not once but twice. One rebate, two broken promises. Mr Deputy Speaker, it's not good enough. Now, Mr Deputy Speaker, I could not talk about health without mentioning my local hospital, the Royal Darwin Hospital, which services the residents of Darwin and Palmerston. According to the Gillard Labor government's own My Hospital website, it's treated over 50,000 patients between June 2010 and June 2011. This is a tremendous achievement, and it's very much due to the hard-working staff of the hospital. However, Royal Darwin Hospital is strained to capacity. And according to the My Hospital's website, the Gillard Labor government set its own target for 2011-12, the final full financial year of the former Territory Labor government, of 69% of all patients to be in and out of the emergency department for the Northern Territory hospitals within 4 hours. Well, Mr Deputy Speaker, sadly, only 54% of patients at Royal Darwin Hospital departed the emergency department in 4 hours. So again, according to the government's figures, the median wait time for general surgery is 31 days. Nationally, it's 49 days. At the Royal, waiting time for general surgery is 31 days nationally, and at the Royal Darwin Hospital, it's 49 days. The Gillard Labor government's own figures show that the Territory Health System is under pressure, and yet it's ignoring these indicators and putting more pressure on the system. It can be argued that the Darwin Private Hospital alleviates a lot of pressure of the Royal Darwin Hospital because the two hospitals work closely together, and because of the fact that 50% of people in my electorate have private health insurance. The private hospital has around 100 beds, which is a third of the capacity of the Royal Darwin Hospital, and it's significantly reducing pressure on the Territory Health System, as I said. But according to their own Private Health Insurance Administration Council, in the 5 years to 2012, private health insurance has seen exclusions and restrictions becoming more prevalent, and that's what those constituents of mine are telling me that they're looking at doing. They've also found that the increased exclusions may work against the policy objectives of private health insurance, easing the burdens on public hospitals. And that's my fear, Mr Deputy Speaker. The Private Health Insurance Administration Council has also reported $1.2 billion worth of prepayments in the June quarter last year as people tried to defer the pain of the Gillard Labor government's cuts causing premium increases. We've seen, which means that we really haven't seen the implications, the full implications of those of the prepayments yet. We've seen slashes to frontline services through the cuts to private health insurance rebates, through public hospitals, and the closure of the chronic disease dental systems. Mr Deputy Speaker, this bill will only further add complexity to the private health insurance industry. The Gillard Labor government's mean testing measures last year have led to the establishment of 12 pricing structures for private health premiums. These measures introduced by the Gillard Labor government today are forcing the private health insurance sector back decades. Private health insurance companies are seeing dramatic increases in their administrative costs to deal with the measures, only escalating premiums further. Now, the Howard government, as I have previously mentioned, cemented the growth of the private health sector. In fact, under the previous coalition government, the number of people with private health insurance had increased by over 75%. Mr Deputy Speaker, let me finish by saying, along with my fellow coalition colleagues, we understand on this side of the House that communities are far better off when the public and private health systems work hand in hand. Labor is not a friend of private health insurance. It consistently has tried to make private health insurance unattractive to Australians and has broken promise after promise on private health insurance. Unfortunately, because of Labor's reckless spending and poor economic management and their incompetence, there is now a budget emergency, and this government is saying these changes are savings measures. We on this side of the House, we don't like these changes one little bit. They go against our DNA, and unlike Labor, we are strong supporters of private health insurance. Mr Deputy Speaker, those on the other side, as the member for Kooyong said, are engaging in class warfare, and think that if you've got private health insurance, you're rich. Well, my electorate's not rich, Mr Deputy Speaker, but 50% or 54% of those people have private health insurance. They are just hard-working mums and dads who want a choice, who want to simply take responsibility for themselves. So I think it's outrageous that Labor think that it's a crime to be aspirational or to take responsibility for yourself. Labor's attack on private health insurance is not fair. This government cannot be trusted, and I hope that on September 14 that the people of my electorate see what's happening and will vote me back in, and so that I can be a member of hopefully an Abbott-led coalition government, because we will not let this sort of stuff happen. Thanks, Mr Deputy Speaker.